Good morning, everyone. Good morning, everyone.
Morning.
There we go. All right. Welcome to 1 Million Cups. Raise your hand if it is your first time here. Oh, new faces, new faces. Okay, cool. So let me tell you how this goes. We have two presenters that are going to get up. Well, excuse me. We have two presentations that we're going to have today, running about 6 minutes each. Our presenters are going to tell you about their business, and then we're going to have an expert panel that kind of drill into their business and ask them some questions, and then we're going to open it up to you guys to answer questions. So get your thinking caps on. By the way, my name is Tyler. I'm one of your community organizers, along with Caitlin, Nicole, Courtney, John, and Kyle. I didn't forget anybody's name, so that's good. And Billy's not here. Next, I would like to have our expert panelists introduce themselves. There we go.
What a difference a day makes. Darcy Howe, the Casey Rise Fund.
I'm Jim Boyle with Justine Peterson.
Awesome. Thank you guys so much for being here. Before I introduce our first presenter, could you please take out your cell phones? Everybody take out your cell phones. Download the 1 Million Cups application if you don't already have it. And if you do have it, please log in so that we can give our presenters some feedback, excuse me, I can't talk today. Please help me in introducing Michael with Smart RX to the stage. Please give him a warm round of applause, everyone. Thank you.
Thanks, Tyler. I hear the microphone is on. That's good. As introduced, I'm Mike Huffer, President and CEO of a company called Smart here in Kansas City. I'm a pharmacist by training, and I'd like to introduce you to our business and to our Nomi software. She helps us with medication adherence. I'm really glad to be here in this beautiful facility. I'm a pharmacist by training, ran hospital pharmacies, and I've been a serial entrepreneur in the pharmacy businesses for the last 30 years. And so today we'll jump in and talk about Nomi. She's our real-time medication adherence system. I want to start with a very scary fact. And this fact has been true since the day I graduated pharmacy school in the mid-'80s. People don't take their medicine. And the fact is, half of the doses prescribed in this country are not taken as prescribed by the patients for a variety of reasons. And when they don't take their medicine, two things happen. It leads to a poor patient outcome. In other words, they get sick or they don't get better. And it has a huge financial strain on the healthcare costs in this country. It's been well published that it's about a $300 billion problem in the United States annually. So our whole job is to try to help people take their medicine, stay on their therapy, and get better. It'll be great for the patient, great for the healthcare system. So I want to keep this very entrepreneurial, and it all started with a bottle. And two founders, Victor and Stefan, had an invention and took out a patent in New York City in a neat little Soho apartment complex a few years ago. And they made this invention. Neither of them had any healthcare or any pharmacy experience, and they made this invention. And a good physician friend of mine, Dr. Denny Mahali, was having coffee with them and saw this device and said, "This is the coolest thing ever. Does it work?" And they said, "Yeah, it works. We just don't know what to do with it." So Denny pulls out his cell phone, calls me in Minneapolis and said, "Mike, you got to see, this is the coolest thing of all time." And they invited me out to New York City. So I got on a plane, went out to New York. I'll never forget the day. It's pouring. I get out of the cab and I walk up. I couldn't really find the building, and I walk into this big incubation room, and here's Stefan and Victor holding this bottle. It didn't quite look like this at the time. And I go, "That's cool, but before we talk, I really need a cup of coffee." Kind of coincidence today. "I really need a cup of coffee." And I said, "Does this thing work?" And they go, "Yeah, it works." So they handed me this bottle with Tic Tacs in it. And I said, "Great, I'm going to take this and I'm going to go get a cup of coffee and I'm going to do something with the bottle along the way." So I went down the elevator and I took a tablet out and put it in my pocket. And I stood in line at the coffee shop and took 3 more out. And then I put 2 more back in. And I went to the hotel lobby and I took one out in the elevator, figuring it couldn't work there. And I got back up, and Victor's standing there when I got back, and I handed him the coffee, and I said, so he goes, I know exactly what you did. And they recited exactly what I did with those Tic Tacs from that bottle, and I was hooked. And I said, if that can work, we can now, for the first time, actually figure out what patients are doing as they're trying to take their medicine. So that's kind of the historical founder story that I like to tell. So we set out to build a system that could monitor all the patients' behavior in real time. Did they take the medicine? Did they miss? Are they confused? And then intervene when we can improve their behavior, escalate to a doctor or a nurse or a family member when it's appropriate, with the whole idea of converting their behavior, improving the patient outcomes, and ultimately that will save money for our customers. So that's what we set out to do. I've got some colleagues in the office, or from the office here today, that have done a really nice job of building out our NOMI system. So NOMI is our real-time medication adherence system. She is our Alexa or our Siri, and kind of all-knowing of everything that's going on from that medical device with the patient and all the people that care about the patient. Quickly, the device captures the data. It has sophisticated electronics in the bottom of the vial, and it knows what happened with that bottle. As soon as it knows something, it timestamps and records the data, looks for a Verizon cell network, and fires the data to our platform. NOMI quickly takes it in, sorts it out based on clinical programs, and then it starts engagement with the patient. So it can send texts or receive responses back and forth from patients. Hey, Mike, it's time to take your medicine now, or it appears you've missed your dose. You've taken 3 instead of 1. Are you having a problem? So it has a direct engagement with the patient or their family members or the other people that might be involved with that patient's care. Very, very cool real-time communication engagement with the patient and the family. And then we have published a very important adherence record. This is information for the clinicians, for the doctors and nurses that have no idea what's going on with that patient. So we publish the adherence record real time for the patients to bring them into the loop. We don't sell to patients and we don't sell to doctors. We sell to the people that are at risk for the care and are trying to take care of these patients, health plans, hospitals, specialty pharmacies, and the pharmaceutical industry. So we're selling an enterprise system, not a direct-to-consumer play. I was asked to show a little bit about our competitors. There are other neat gadgets out there, gizmos as I call them, that can capture patient data. Here's one called Glow Caps. Here they have a cap that knows when the patient opens or closes the vial and can keep track of that. There's another one called AdhereTech. They have a nice little glowing ring around their bottle, and it glows and helps prompt the patient to take their medicine. The patient dumps their medicine from the pharmacy into this bottle, and they try to capture the data in a device that looks just like that. And then there's one called MEMS caps, and this is used for clinical trials, where the patient takes their clinical trial medicine home, and it keeps track of how many tablets came out. And then when they're done with the trial, they send the cap back to the researcher, and the researcher downloads the data and says, Darcy just took her medicine in this pattern. So there's some other neat gizmos out there. And I applaud all of that. I don't have any beef with the other technology. Where we differentiate is in the NOMI system. It's not how we capture the data, it's what we do with it once we have it. And so our key differentiation, and we've spent a lot of time and money to get this right, is to build that engagement engine to try to change the behavior. It's not just knowing what happens, but you have to change the patient's behavior. And then we're very good at providing the information, actual information to the clinicians that have no idea what's going on with their patients. So that's the problem that we're trying to solve, and NOMI's off and running. We commercially launched this in 2017, and we are now growing customers. So we're executing our plan and trying to grow our customer base. Quickly, the bottle is the first start, the platform is the home run, and we're now trying to extend to other medication devices that can capture data, whether that's a nebulizer to keep track of inhaled medications, or if it's a self-administered injectable like an EpiPen, did the patient take their shot? or blister pack for elderly patients that might be on 10, 12, 15 different medications. The idea is we need more sensors, and the more information we get into NOMI, the more powerful she can be to help fix the situation. So that's where we're heading. And this just gives you an idea. This is how NOMI looks with the sensor coming from a nebulizer. It's the same story, it's just a different sensor technology. So that's my 6 minutes. I went over by one. My ask is we're trying to grow this business. We're executing right now. So my ask to this community is if you know of a hospital, a pharmacy, or a payer that's looking to take care of these very sick patients and they need help with adherence, we'd love to have an introduction. And with that, I'll stop.
All right, we're going to turn it over to our experts. Yes, round of applause. Sorry. Round of applause first, and then we'll turn it over to our experts.
Thank you, Mike. This is really important work, and this is a really great indication of the kind of thing that is happening with technology. It's improving our everyday lives, and I love that aspect about it's not just some gizmo for the 1%ers. This is something that people really need. So if my grandmother is, help me understand how I, as an individual, anyone in the room can utilize this information, even if we are not the people taking the pills.
So our business model at this point is not a direct consumer. So I couldn't go buy this for my 85-year-old father. We've built this in an enterprise fashion, so the insurance companies or the pharmacies or the hospitals can provide this to the patients that they're taking care of. So right now, it's not a direct-to-consumer model, it's more of an enterprise model. But we're working with the Kansas University Hospital here on hepatitis C program and a Parkinson's program and soon to be bone marrow transplant. So that's how patients would engage our system.
So that's what I was going to ask you next is give us an example of how, why the KU Med would want to do this and what this is going to do for their program or for the people who are interested in engaging with you on this.
Well, let me answer that with a story. This just actually happened yesterday. So we're working with Yale Cancer Center on an oncology program with the oncologists there. And they're working with patients that are on a drug called Xeloda. It's a cancer therapy. You have to take the medicine 2 times a day, and then you have to take it for 7 days and then stop for 7 days. So it's a very complicated regimen. And we got a call yesterday that they were stunned. One of their patients was supposed to take 2 tablets in the morning and 2 tablets in the afternoon for 7 days and then stop. And NOMI figured out that the patient got confused and took 4 tablets in the morning and 4 tablets in the afternoon because they thought they were supposed to take, instead of 4 per day, 4 each dose. So NOMI saw that, captured that, alerted the physician, and the physician said, wow, we just prevented a big problem. So here, this was about quality improvement, prevent readmissions for these cancer patients. And so they're really using it to mitigate their risk in the hospital or mitigate the risk in the health plan to get the therapy right and not lead to a catastrophic event.
It can't be inexpensive. Help us understand what the economics of this and how you make money.
It is not inexpensive. So the bottle has a cost to it, and we have to deploy this into a very busy healthcare system. So we are not selling bottles. We sell the entire system that includes the software and the hardware all together, and we charge our customers on a per enrolled patient per month. So it feels like a disease management program or an adherence management program and not really a technology play. The cost of the bottle is expensive. It's between, well, we're trying to get it down, but it's about a $70 bottle now, and so it's expensive technology. And we have to prove out the value that if we're going to deploy the system and the technology, we need to have a value that gives our customers a return of, probably 5 times that. So one of the ones that we've done here at KU is Harvoni is used to treat hepatitis C. That's a $60,000 medicine. And if people miss 3 days in a row, all the medicine that they've taken has been completely wasted. So we're watching every single dose, keeping the patient on therapy so that they don't have to restart. So in that case, we're trying to save a $60,000 course of therapy. So So we're trying to chase the bigger, sicker, most important cases.
My co-asker up here would like to defer to the audience at this
Okay.
point.
Let's go ahead and open up to the audience questions real quick. I've got one here in the center.
Thank you for your presentation. Your product is amazing. I'm very, very excited for what this is doing for healthcare. My question is from the patient side. Do you have any data that might illustrate how this would affect prices for them for a healthcare system? And any studies that have been done through your partner hospitals or anything?
So how would impact prices for them, or? Yeah, it's a complicated situation. The patients, when they receive their medication, are typically on the hook for the copay, for the cost, for a small portion of the cost of their overall medicine. So they're not going to see a drastic reduction in the cost of their copays or their meds, but if done well, it's going to keep them out of the hospital, out of the emergency room, and so the impact of the patient is really to get them better, healthier, and have a better patient outcome. And it's really not focused on changing the cost of the therapy for the patient or their financial copay. I hope that answered your question.
Question on your right.
Yep. Great presentation. Thank you so much. So how does this differ? I think I've read where they actually have pills that are smart pills that send the signal back to whomever's monitoring or to your iPhone or whatever. So how does the bottle versus the pill help me understand?
This is a great question. So there's some fascinating technology now where they're putting sensors, small little sensors inside of a capsule or a tablet. There are two companies doing this, Proteus, where they've got FDA approval to put a sensor so when the tablet gets ingested, the stomach acid fires the sensor. It talks to a patch on the patient's skin. The patch then talks to their cell phone and fires the data off. So it's fascinating. And then there's another one, there's a gelatin capsule with the same type of thing. So we love that technology. It's more precise than our bottle because it knows whether it was ingested or not. We just know what came out of the bottle, so it's more precise. Frankly, we're working with both, or certainly with one of those companies, to have NOMI to be the back end once they capture the ingested sensor data. So we see them as not a competitor, but as a strategic business partner because they don't have NOMI.
Question here in the center.
Does this, or how does this change any of the clinical relationships with pharmaceutical companies and how they perceive this?
Pharmaceutical companies are knocking down our door because they have a problem when people don't take their medicine. So they have, when somebody doesn't take their medicine, their drug doesn't work, so they get a poor clinical outcome and they lose revenue. So they're coming to us with both of those hats on. How can you make my medicine better, and how can I get more revenue? They're also interested in making sure that their drug works so that the payers pay for it. So they're worried that they're going to bring out new cancer therapies are coming out. They're $4,000 to $6,000 per month. And the payer's like going, wow, that's a lot of medicine, that's a lot of money to spend for cancer treatment. I'll pay for it if it works, and if it doesn't work because of adherence. So the pharma industry is coming to us to see if this technology can improve the outcome and drive revenues for their new expensive products. I don't think the generic manufacturers are going to come knocking on our door. Just candidly, it's the newer specialty pharmacy industry that's poignant here.
Question in the middle.
Great presentation. My question pertains to the post-discharge process within a hospital network, the retrieval of that information, and depending on that post-discharge, the variation that could be, or preventage in auto-renew scripts. So cases where, hey, stop taking this medication, but auto-renew scripts have been sent out or for delivery within a pharmacy network. Does that make sense? Kind of the process where I'm going.
I'm going to try to, I think there's two issues here.
Right.
And the first one is hospital readmissions. And for the audience, today in hospital reimbursement, they're working with the payers, and they usually get some kind of a case management or a bundled case rate. And so they get paid to treat Mike's heart attack, and they get a bundled case rate. And if the patient ends up going back into the hospital within 60 days, they're on the financial hook for that readmission. One of the biggest reasons people end up back in the hospital for a readmission is because they don't take their medicine. So we're all over that, and hospitals are interested in that. But your second part of your question is about auto-renewing prescriptions. And right now, CVS or Walgreens, they'll just send the patient more meds every 30 days, whether they need them or not, or whether they've taken them or not. We now have the insight to know, does Darcy really need that refill, or is she ready or not? And so we can provide information back to the payer or to the pharmacy to make sure that's appropriate. What we're not is we're not the police officer in the middle of that. We're not gonna be judge and jury. We just provide the information for somebody else that might wanna take on that waste.
Question up front.
This is a great idea. It's a good application, I think, of technology to a problem that's existed forever. I remember, those of you who know me will know this was a long time ago, but when I was researching the efficacy of contraceptives, that the efficacy rate, and I'm not a doctor, so you know this better than I do, but the efficacy rate includes all those cases of maladministration or non-administration of the device or medication. So I would think that this is probably true today for whatever medication that researchers will report on efficacy. So this can help a huge amount of in changing the story about how effective things are. So that's my little factoid from the past, because I was extremely surprised to see how efficacy rates were calculated. So my question, the short one, is, so when you did this thing with the candy, I can't remember what the candy was, the Tic Tacs, how did it know you put it in your pocket? I think it knew you took it out of the thing, because as far as I can tell, you have a scale that measures. But in terms of you actually consuming.
Yeah, this is a good question. It knows exactly what came out of the bottle and no more. So it didn't know if I consumed it, threw it in the trash can, or put it in my pocket. And then I thought I could trick it with Victor, and I said, I'm gonna take out 3 and put back 2 just to see if it could discern that, and it could. So what we're doing with the bottle today is just a proxy for ingestion. And the previous question is very interesting. Actually, knowing the ingestion is another section. So we're a proxy, and then I showed the competitor that just knows cap openings. So they know something happened, but not how many tablets. So there's a continuum here, and I think all of that information is valuable to varying degrees.
Question on your left.
I really appreciate your presentation this morning, and just, you probably already know this because you've given this presentation enough times, but as I was processing what happened in my head, at first I'm like, okay, I get the problem, right? We're all right there with you. And they're like, oh, that's a cool solution. I see what they're doing. Great. And then you started showing us how big this market is. I'm like, oh, wow, there's so much they can do. And then you started showing us all the different ways people are attacking it. And I really like that. You know, within I don't know, 10, 15 minutes, all that kind of exploded in my head as I've been listening to you, and I appreciate you bringing that to us this morning. You know, one of the things I can tell is you clearly know the market you're in. And one of the things as an entrepreneur I always struggle with, I'm curious what lessons you can give us on this, is knowing when to not chase an opportunity. It seems to me you have a high level of awareness here in places where you don't fit, markets you don't fit, and quite frankly, as the more you share with me in this presentation, the more I realize, yeah, this idea isn't, quite frankly, no offense, as big as it first felt. And I want you to kind of take us down that journey, whatever you can in a couple minutes, in terms of how you've realized where this idea really fits and how to monetize it as an entrepreneur.
I could write a book on your question, and there's a bunch of parts to it. First of all, I make it sound easy, and the market is gigantic, and the problem is big. But one of the things that I didn't really showcase is dealing with pharmacy and medicine is really hard. It's highly regulated. We've got HIPAA privacy. So there's a whole bunch of hard parts to make this work. So I want to just acknowledge that. And then you asked the $1 million question. It's this big of a problem, so what do you chase? Do you chase everybody? Do you chase Mikey Huffers on his Lipitor? Or do you chase the heart transplant patient that's got a $175,000 LVAD pump on their heart? So and Victor and I fought for years about, is this a consumer play to sell to the family members, or should we sell this to the enterprise? So we had to chunk this down, and we started and said, we're going to go to the enterprise because that's where the big financial risk is, and they're on the hook for that risk. And then should we chase all patients, or should we just chase the ones that it makes the biggest difference? So the fact in this country is about 10% of the patients use 77% of the healthcare dollars in this country. So it's cancer, transplant, MS, Hep C. So we've started there, and we'll move into the middle, into some of the healthier populations, but we're going to stay on that 10% of the patients. So the market is this big, but we're chasing the sickest, or what we call the highest value opportunities. And those decisions are hard because we get called all the time. Hey, will you do this for my new drug? If the value's not there, I have to say, do I want to, or should I? And so there's some very difficult decisions along the way. One more. So the one that's hot right now is opioids. So it's a big problem. It's all over the paper. We're going to do it, and I like it because but it isn't really a big high value play for the insurers. But it's a huge issue for our society, and there's a lot of money there to go out and tackle it. So we're going to do opioids, but that's one of the areas that we've deviated to because it's sitting right there. We're going to go chase that one.
Perfect. Last question, Mike. What can we, and I know you talked about this earlier, but what can we as a community do to help you?
Yeah, so we are off and running trying to grow the business and execute on this plan. So if there are other sensor technologies, and there's some very neat ones out there, other sensor technologies or partners that you think we could fit in well with, we'd love to hear that. If there are enterprise customers for us that need this, and most of them do, any sort of an introduction to what we're doing, or just sending them my contact information would be very helpful.
Perfect. You guys heard it. Give them a big round of applause. Thank you so much.
All right, good morning. Thank you all so much for joining us. I am Kyle Smith. I'm one of your organizers. We're going to start setting up for this How We Funded It panel. While that goes on behind me, I have a quick ask for all of you. So I have the incredible opportunity to represent 1 Million Cups at the Global Entrepreneurship Congress in Istanbul, Turkey, April 16th to the 19th. Thank you. I want to be able to share 1 Million Cup success stories, because that's really the heartbeat of this community, is the entrepreneurs who have presented. So if you have presented at 1 Million Cups anytime in the past 6 years, we're celebrating our 6th birthday this month, find us on social media. I'm putting out a Google form. I want to be able to tell your success stories. If you know of any 1 Million Cups presenters from way back in the day, tell them to go find us on social media. So that's Facebook and Twitter at 1 Million Cups KC. All right, thank you. Let's do Mug Club. Can you please raise your hand if you have been to 1 Million Cups 10 or more times? Put your hand down if you already have a mug. I see one in the center.
I see one. I'm coming. Good morning. Please tell us your name and why you come to 1 Million Cups.
My name is Dave Moley. I started coming in last August. I started my own software development company. So I like coming to 1 Million Cups. I like the energy here. I like hearing stories, and maybe I learned something.
Okay. We hope so. Excellent. I'm going to welcome Mike back up to the stage while that happens. So we are excited to present to you this morning a panel about how early stage entrepreneurs fund their businesses. You're going to hear from the perspective of the entrepreneur and also the funder this morning. But before we dive into that conversation, can you please raise your hand if you are an entrepreneur who has had to figure out early stage financing before, or if you're currently in the midst of that battle? Let's see hands. Awesome. Well, we are excited to give you some real life information and some stories about how entrepreneurs make it work. And hopefully we can dispel some of the myths that are out there. I think there's a big myth created around Shark Tank that we all think if we just have a good enough idea and someone gives us enough money, we can make it work. But that's not the only way to get your business off the ground. So let's do some introductions. You know Mike. You may have met him in the first hour of this programming. So let me introduce you. Let's actually start with our funders. So at the beginning, Darcy and Jim said hello, but let's give them a chance to talk a little bit more about their funds. Darcy?
The Casey Rise Fund is a venture capital sidecar fund. What does that mean? So when you are an early stage company, you start with your friends and family and your credit cards and seed funding, and then angel funding. This is on the equity side. And then venture funding. So venture funding is generally at the stage where you have customers, not necessarily profitability, several people in your company, and the market has shown that, and this would be paying customers, the market has shown some validation for your product. And as a sidecar fund, we only invest in Kansas City area companies, actually Manhattan, Kansas to Columbia, Missouri, along I-70, 2 hours east and west of us. But we can only invest in a Kansas City area company when another venture firm, of which we have done our diligence, approves that fund. And so if they invest in that round, then we invest alongside them.
I'm Jim Boyle with Justine Peterson. We're a micro-lender based in St. Louis, but lending in Kansas City. We were invited here by the city in 2012 and have done many loans. I didn't come prepared with numbers. I'm filling in for Lisa Zimmerman, our Kansas City senior loan officer. Darcy lives in the macro world. I live in the micro world. That's my little pond we swim in. Average loan amount, about $7,000 to $8,000. We lend anywhere from $500 to $20,000. We're a secondary lender. We're looking for those businesses that cannot get approved with traditional lending banks. Our credit requirements are less than a bank requires. We will work with startups, which again, banks tend to not lend to. And the dollar size is also something banks tend not to lend to. Again, $3,000 is a very common loan amount for us and can do a lot for the clientele that we work with. Lawn care businesses, daycare businesses, hair salons, et cetera, bakeries. But it's a simple process to apply. I have some handouts here that I can disperse after we meet, so thank you.
Jim, well, that's a perfect segue. You mentioned hair salons. I'm excited to introduce you all to a Justine Peterson loan acceptor. There's a better word.
And if I may, a graduate of Justine Peterson.
Awesome.
Our goal is to be a temporary lender. I'm in the business of losing customers.
Excellent. So
And I love when that happens. So I'll turn the mic over to Erica.
Excellent. Erica, please tell us about beautiful hair.
Again, my name is Erica Ruiz. I don't really like talking in public, so this is really weird for me. So I'm just going to say that right up front. I do well behind a chair and not on stage, so bear with me. But I decided that I wanted to open a salon after I was in the corporate world for a long time, making decent amount of money. I had 2 kids. I was a single mom on my own. And so I would sit in the conference room and look at people, and I'd be like, man, I could do so much with this person and change their hair and do this and do that. And I'm like, I don't belong here. And so my boss would all of a sudden have me like sit up and talk in front of people, which, as I said, is not my forte. And I decided that I just wanted to do something else with my life, but I never did it because I was just making good money. Well, tragically, I was diagnosed with cancer, and I wasn't able to do something like that right away. But it did teach me that if and when I get through cancer, I want to do what I was meant to do. And I wanted to make people beautiful, and I wanted people to feel good about themselves. I wanted to make a difference and provide beauty to the world, make people feel as beautiful as they are on the inside to the outside. So after 9 months of chemo every other week, I came back full force. Thank God I am 100% recovered. There's no cancer in my life anymore. And I went to hair school and decided to booth rent at a salon in Overland Park. At the time, it was called Beauty Obsessions. The owner of that salon gave me the opportunity to, I remember the first question actually, he asked me, hey, do you want to what's your 3-year goal or your 5-year goal? And I said, well, honestly, I want to own a salon. Well, I was taking a huge risk because he was the salon owner. So I think that's actually what he was looking for. You know, there's a lot of salon owners out there that don't know how to do hair and don't know how to deal with stylists, because we are a little crazy sometimes. So that was a joke, you can laugh. But I wanted to provide a salon where we could have 401ks and where we had disability insurance, vacation, sick time, which those are things that most salons anywhere don't provide. I wanted salon education and marketing for my staff. So luckily, my spouse is a really good finance person, since you know, a lot of stylists work with their artistic side of the brain and not the finance side. So he kind of does all that, and then I do the staff part of it. I train, and I can concentrate on customer satisfaction. So we are a full-service salon. It's a hybrid salon, so we have some booth renters, and then we have some commission stylists. Booth rent is just when a stylist comes in and rents their section, and then commission, obviously, we take part of the commission and provide everything for them as far as hair color and products and all of that. But our goal is to individualize each look based on your lifestyle. We want to enhance your best features. We want to enhance your complexion, and I'm excited to say that now we're on our 3rd year since our grand opening.
Awesome. Well, let's not wait to the end to show appreciation for Erica for stepping out and sharing her story. And that's actually a great place to start. Erica, can you tell us more about how you started financing Beautiful You? How did you go from a booth renter to a business owner?
So like I said, I started booth renting at the salon on 95th and Metcalf. At first it was called Beauty Obsessions. I changed the name to Beautiful Hair. And it's B-E-Y-O-U. I think that was important to me because in my past, I felt like I could never be myself. You know, I was in the corporate world, and that just wasn't me. When I was a kid, I was kind of made to be a certain way, and I'm like, that's not who I am, and I want everybody to be beautiful in their own certain way. And I just didn't have quite enough. I had enough to purchase the business, but I didn't have enough to have a fund, basically, if something were ever to happen. You know, obviously, since I did have cancer, I was expecting anything at that point. You know, what if I was taking over a salon where there were all of these booth renters that had been there a long time before me. Some of them had been there 20, 30 years. And then here I come along, this like younger girl wanting to take over a salon. I was afraid that they were just gonna walk out. So I needed about $10,000 to prepare for anything that would go wrong. And really, I talked to probably 4 or 5 different big banks, and I was tired of having, you know, an entire week or 2 weeks or 3 weeks of, we need this paperwork, oh, well, we need that paperwork. And then at the end, they would say, oh, sorry, you don't qualify. And I'm like, why? I have really good credit, and it's only $10,000. And most of them said, well, that's why. It's only $10,000. That's nothing for us. So I'm like, well, where do I go now? And I met Juan Ramirez at Arvis Bank, who referred me to Lisa Zimmerman, and that was with Justine Peterson, and he started telling me about microloans. And I said, you know what, this might be the best thing ever. The interest rates were good. It was super easy. She actually met me at the bank, filled out some paperwork, and probably less than a week later, I had the 10 grand.
That's awesome. And I'm excited to hear more about that from the Justine Peterson perspective. But before we go that direction, and as we head into the financing conversation, Darcy, can you just define some terms for us? What is the difference between debt financing and equity financing?
So a venture firm is equity financing, and think about equity financing as like the stock market. You own a piece of the company, whereas debt financing is, think about a certificate of deposit, or you go to the bank and they give you an interest rate. So equity financing is you're giving up a piece of the company, but you're expecting a bigger return. Debt financing is more you're loaning money to that, in the case of a CD, you're loaning money to the bank, they're going to give you an interest rate and you get your money back. So that's basically the difference between equity financing and debt financing in a broad sense.
Excellent. And Jim, where does Justine Peterson fall in this perspective? Can you enlighten us all on microloans?
Has everybody in the room heard of micro lending? Who hasn't? It's essentially a niche dollar amount, $500 to up to $20,000 typically. We can lend, there are exceptions where we can go a little higher than that. The average loan amount is about $8,000 to start. We do a lot of $3,000 loans, and as I said earlier, there's a lot of businesses that can do with that essential startup loan, because we have this step-up process too. We can do up to $3,000 with no collateral, priced anywhere between 7.75 and 12% for female-owned businesses. And after 6 months, 8 months of on-time payments, because we create a relationship with the borrower, of on-time payments, we can consider another 1,000 or 2. Once we get a little higher than that, we are looking to have the loan secured, because we're on the hook for every dollar we lend. These are not guaranteed loans. We borrow money from the SBA.
Jim, in general, what type of business owner or early stage entrepreneur is appropriate for a microloan?
Any business that is legal. I mean, again, as I stated earlier, we do a lot of mom and pop catering businesses, daycares, hair salons, lawn care businesses. I could go on and on, but and the key here is, as Erica said, she actually answered almost all my questions, and you are a wonderful speaker, by the way, is that we can lend to a startup business. I mean, we're looking at ability to pay. Credit, I mean, I deal with a lot of 560, 70, 580 credit scores, okay? Exception here in Erica, who had a wonderful credit score, which makes the underwriting much easier. But we're looking at how is one paying their active credit lines now? What do the bank statements look like? I mean, we're going to hesitate to lend money to one who has non-sufficient funds on a regular basis, because we don't want to set that borrower up with a payment they can't make. We don't want to set ourselves up with a payment they can't make, because we try to keep our delinquencies and write-offs down to about 5%, which we can, 5 to 7% actually. Our mission as a nonprofit is to take risk on individuals based upon what they provide us financially. But don't complicate what we do. It's really simple. We look at credit. We look at bank statements. The larger the loan, we're doing some cash flow analysis as well, and taking into account projections, et cetera. But the application process is quite simple as well.
Excellent. I want to bring Mike into the conversation. Mike, where are you in your financing journey? Steal that mic from Erica. Yeah.
So when we started the business and wrote the business case, we needed to get some funding to start. And to start would be build out the bottles, build out the software, and hire some staff. So we started with a friends and family convertible note round. So we went out to people that had invested with me or that I knew before, and they made the initial investment. That initial investment was $1.5 million to get us going. And then we established our Series A round of financing, was a private equity round. We got a lead investor, and then our friends and family converted into that Series A round. We put that money to work, and it helped build what I've shown earlier today. And now, as we're trying to get to the expansion phase, we need more money for growth and expansion. And we have a Series B round in place right now where we have a lead investor. KC Rise is a follow-on investor to the round, and we're trying to close that out as we speak. So more the traditional private equity path.
Yeah, I want to go to Darcy next. Can you just comment on each of these stories from your perspective? What do you see here? What do you see that applies to all of us?
So obviously, Mike has some nice friends and family that he can get $1.5 million in friends and family, right? You know, but I think this is also a good story about Mike's a serial entrepreneur. He started in the pharmacy business, but he's a serial pharmacy entrepreneur, and he's developed relationships with people who say, I loved what you did before, you're a trustworthy guy, and that's how Mike can get $1.5 million round for from friends and family. When he was in that round, he approached me because he heard we were putting together the KC Rice Fund, and Mike and I had kids that went to school together, and I never knew what Mike really did until now. And so I saw that, but it didn't have enough traction yet. He didn't have customers yet, and he didn't have the venture firm in place where we could be the sidecar to his venture firm. But I think the great thing that Mike did is he helped me to know the business and to begin to build a relationship with him about what's the business doing, and then I could see the traction. So when he got to the point where he got to the venture round, it wasn't brand new to me. I had a lot of faith in Mike, and what I needed to do then is do my diligence, and also my partner, Ed Frint, is in the back there. We did our diligence on his venture firm that I could be then comfortable that I could cycle them.
I'd like to also say, don't hesitate to talk to family and friends, okay? I hear occasionally, well, I want to do this on my own. You know, don't necessarily. We really love, as an underwriting, to see that there's family, that some family members are on board with these, especially in the larger loans, the 8, 10, 12Ks, so.
Here in just a moment, we're going to open it up to you for questions, so start brewing on those and get ready to throw your hands up. I want to come back to our entrepreneurs for just a second. Looking back on pursuing financing, is there anything you wish you would have done differently? Do you have any advice for early stage entrepreneurs out there who are trying to figure out how to finance their big idea?
I think for me, I went through so many banks at the beginning that I was kind of fed up at the end. And I'm like, you know, you guys have pulled me through every loophole. And after so much time, and after, it's like they would ask me for one document and I'd put in a document, and then weeks later, I'm like, what's going on? And then, oh, well, by the way, you need this, and by the way, you need that. Now, granted, my situation was a little bit difficult because I was booth running right before I needed the loan. So all of my money was tracked by, you know, my taxes, and that's pretty much it. So it was hard to get a loan through a bank, but I just wish that they would have been upfront right from the beginning. And I think that it's important to be upfront from the beginning, because the last time that when I found Justine Peterson and I went to Arvis Bank, I remember talking to the loan officer, and he says, okay, so what can I do for you? And I'd like to meet you in my office. And I said, well, first of all, I just want to tell you that these are the documents that I have, And if you can help me, you need to tell me now because I'm not going to be here in a week to give you any more documentation. Like, this is what I have. Tell me if you can take it or not. So luckily, they said yes, they could take it. And I think that would be my advice, to just be upfront right from the beginning with whoever you talk to.
Mike, any advice?
I don't have too much to share, but a couple things. Raising money takes a lot more time than you think. So it's not just a couple of pitches and it happens. You have to continually work and groom and educate. So that's just a lesson. The other lesson is you can't do this just by having kind of an internet accountant or a fly-by-night attorney. To raise money and the amounts that we're talking about, you have to have a bona fide legal counsel to help and write the paperwork. And there's a bunch of regulations around with that, and you need to have really a world-class accountant to make sure that everything's by the books. You can't. When I met Victor and Stefan early, they just had a quick little application online for a couple of those things, all of which isn't acceptable to raise the amount of money that we needed to put this business to work. So the front end is not the time to cheap out on legal or accounting. And it's expensive, so be forewarned.
If we have any questions out there, please go ahead and get your hands up. I'm going to ask Darcy a quick question. We heard from Jim's perspective what he's looking for in an entrepreneur in order to provide a loan. What are you looking for in an entrepreneur in order to invest?
Well, first, it has to come with another venture firm, and sometimes we help get that venture firm, but I'm looking for, let's just say, a good listener, super passion and drive, a big problem to solve, not a small problem. You see what Mike's, he could try and boil the ocean. There's a lot of ocean for him to boil, so I think it was a good thing that he was going for a large market and then focus on, you can't boil the ocean when you're a new business and you have limited resources. So what's your focus and how are you going to use that focus to then continue to grow in other areas? And I also say that culture, you've got to start building culture. If you're just yourself and two other people, you need to build the culture of a company the way you want it. You want others to attract other talent to you. I've seen some entrepreneurs that I think are not great culture builders, and that is a turnoff for me in terms of what I wouldn't be as interested in investing, is people who don't listen well, people who it's all about them, they're the smartest guy in the room, and the kind of stuff that you just think it's that person can't scale a business.
I have a question. Is that okay? I'm right here. In regards to the microlending, I'm not sure if I heard you correct, but you said it was up to 12% for female business owners?
Yes.
Is there a difference between female and male business owners?
Interest rate wise, potentially, yeah.
Why?
Because we have a relationship with Elizabeth Street Capital that will fund some of our money in order to be able to lend it at 12%.
Okay.
Erica, you're in your third year now. Can you tell us your vision for the next few years?
My vision in the next few years is to probably provide a receptionist for the salon. Right now, we've got our stylist kind of taking turns and doing that for us. So I definitely want to hire a receptionist. I think we need two or three more commission stylists. Thank goodness we've got a lot of business and a lot of people coming to us. So we need more staff, and we're a little picky about hiring. We just want the right fit. So I think that's what we're looking for in the next few years.
Mike, can you tell us about the relationship that you have with your investors?
Yeah, so I've already admitted that a serial entrepreneur had some successes in the past, so they came in familiar with me, my history, and the healthcare industry. So my relationship with my investors is not all about the money that they're providing for the business, but I tap into them for expertise, for connections, relationships, and advice. Some of them I've invited onto the board. So for me, it's not just about money, but it's about contacts and helping us actually propel and grow the business. One of the problems with a small company is you can't hire all the talent that you need. I'm used to actuaries and, finance people, and I can't afford to pay for all that. So I need to tap into advisors, and I tap into my investors for a lot of the expertise that I can't afford. And in Kansas City, there's some people here that are world-class serial entrepreneurs as my investors, and they have a lot of wisdom that they can share, and they do.
And from the funder perspective, what sort of relationship do you want to have with the people you give money to?
Communication, communication, communication. We go out and see our portfolio companies every quarter. I mean, the beauty of who we are, and which is relatively unique in the U.S., is all of our investors and all of our portfolio companies are here in the backyard. So we try and tap into our investors. A good example, we do something called a coffee with, and Mike was our featured guy a couple of weeks ago. It's just one portfolio company, and any of the investors who want to hang out and have coffee with them. Mike told the story, did a deep dive. We have some very sophisticated investors in our fund, and they shot a lot of questions. I learned from some of the questions that they asked, but more importantly is they jumped in, they got more engagement with Mike, and now they're trying to help him raise some money and make some introductions as well. So that's a pretty ideal way, as one story, as to how we think we can help. Our network can help. Reach out to us and utilize our network. Help us to understand how our network can help the portfolio.
I'd like to chime in with a very poignant example. So we're in the bottle business, and we're really in the data business, and we wanted to improve our bottle performance. And I was desperately looking for a world-class engineering firm that could help take our bottle from 2.5 to 3.5. And Darcy said, I don't know anybody like that, but there's an entrepreneur named Pat McKenzie that I'd like to introduce you to. So we brought Pat over, and he was great. He helped us figure out who to look at, who not to. We didn't have that expertise. And so through the KC Rise, we got a connection that led to something, and now we've got a strategic business partner that's helping with bottle production as we're building software and building out the NOMI engine.
Jim, I want to tweak that.
And Pat, I got to say, Pat was a retired guy looking for something to do, and it's so fun. He's like a kid in a candy store. He's having so much fun with Mike and helping his business.
Jim, I want to tweak that last question a little bit and ask you, when do you want the relationship to start between you and an entrepreneur? Is it when they show up in your office asking for $10,000, or is it before that?
Well, opportunities like this allow it to be before that. Again, prepare yourself, ideally with a business plan. We don't require an extensive one. Again, I mean, a lawn care business, $3,000 loan, we're not asking them to spend $500 or $1,000 on assistance with a business plan. But essentially, yeah, the relationship starts with a phone call, almost always. Wherein the first question typically out of my mind is, how much do you want to borrow? That way we can get an idea of if there is going to be a relationship. If I hear 100,000, then I tend to say, well, do you understand what we do and don't do? Then the conversation normally lasts, 10, 15 minutes, 20 minutes. Frankly, I'm not much interested in the business at that point. I'm much more interested in what they know about their credit, how their bank statements. I mean, I really, in that conversation, want to start to underwrite and not waste the borrower's time, but get right in there so I can answer see if I can do something. And then I specifically am requesting a small little bit of documentation, bank statements, tax returns, and permission to pull a credit report. And that way we can know pretty quickly what we can do for that borrower.
Excellent. As we draw this conversation to a close, thank you all for joining us this morning. I want to ask our traditional closing question to Erica. Erica, what can we as a community do to help you?
Come get your hair done. Like I said, we're at 95th and Metcalf, beautiful hair. If you have a stylist in mind that would like to work in a fun atmosphere, we're family friendly, not stuffy, then send them over and come. Even if you don't want to get your hair done, you just need some shampoo or conditioner, come come to our salon. I think that's the most that you guys could do to help me.
Excellent. Well, to keep learning more about Kansas City's entrepreneurs, continue to join us week after week here at 1 Million Cups. We're here every Wednesday at 9 a.m. If you're interested in learning more about what's going on in Kansas City's capital ecosystem, I'll refer you to KC SourceLink's new We Create KC report. So that's coming out at the end of this week. If you are a subscriber to the Kansas City Business Journal, which you all should be, you will receive a copy in your Friday issue. Thank you all so much for joining us. Thank all of you. We will see you next Wednesday right here at 1 Million Cups. Thanks, guys.